speak. And I will start my stopwatch. And there we go. We are with Doug Cowan, who is the president and CEO of Community Services League. It's so great to be with you. We are safe, spaced.
Right.
But it feels like we're kind of in the same room.
That's right. I think for all of us, our perceptions of normal have certainly changed. And in fact, I've found myself times that I usually would have just picked up the phone and called somebody, I've requested a Zoom because it's just great to see that person's face and to be able to interact as if we were meeting here in the office. So it's great to be with you today. And I've had the opportunity to be on the program before. And so it's great to be back and appreciate all those folks that tune in and learn about things that are going on in our community.
It's been a little while since you've been on. Let's do a quick refresher. Community Services League. That sounds really big.
Doesn't it?
It does. And looking at your website, which folks should definitely visit, which is cslcares.org.
That's right.
Bring us back in, refresh us a bit on what you all are about and what you're doing, especially right now.
Sure. I oftentimes joke with folks that we have one of those wonderfully ambiguous social services names that sounds nice, but doesn't really tell you exactly what we do. But one of the reasons for the name, I mean, you think about league, that's kind of an outdated term that we don't use anymore. CSL, our roots go back in June. So next month, actually just a couple weeks, we will turn 104 years old. And the roots of the organization trace back to a women's Bible study group centered around the historic Independence Square area, an ecumenical Bible group. So women from several different churches in Independence, but most notably, one of the women was a young Bess Wallace, who 3 years after we were founded would become Bess Truman, and then of course the rest is history. And so the founding of the organization is often credited to former First Lady Bess Truman. But here we are 104 years later, and Community Services League has the distinction of being one of the largest social service agencies throughout the metropolitan area. And with our headquarters in Independence, many people think of us as just an Independence or Eastern Jackson County organization, but our reach is throughout the metropolitan area. I think, have folks from last year, 15 different counties and scores of cities that accessed our services, whether virtually or in person. And so today, Community Services League really has four big pillars of work that most people would recognize, and that's income supports, which it helps families struggling. Income supports can mean a variety of different things, whether that's our food pantry, helping keep families stably housed, et cetera, et cetera. Our financial coaching works one-on-one with families to help set financial goals and really tracks through metrics, improvements in household income, net worth, and credit scores. Another big pillar is our employment services program, where we train folks in new careers. We help place them in new jobs. We also work with adults with special needs and accessing customized employment. And then we are a HUD certified housing counseling agency. And under that housing counseling umbrella, we do a lot of things, whether it's teaching homebuyer education, we do homeless street outreach, we provide permanent housing for folks that used to be homeless, and a variety of other things within housing. So those are four big things. There's other things that the organization does, but those are the programs and services that people most identify with Community Services League. And we offer all of that at 13 area locations. Between our offices are in both Jackson and Clay counties, but as I said earlier, we serve people from throughout the metropolitan area.
What don't you do?
That's a good question. There's not a whole lot, and we keep adding to our repertoire. One of the reasons we do offer a lot of services is we have offices in both big cities and small cities. And what we found is that, and I think most people listening to the show would certainly understand this, that living poor can be very exhausting if you're accessing services, whether they're private supports from an organization like CSL or public benefit programs, government supported, working to try to stitch those resources together, especially if you don't have transportation, can be a very taxing thing to do. And so, and I think we reflect on this in our own lives, that we can't just have a conversation with only about basic needs or only about housing or finances or work. The reality is those conversations are all intertwined in all of our lives, and they all affect each other. So that has brought a real scale of efficiencies to our the work that we do. And so when clients meet with us, they will oftentimes be meeting with both a financial and employment coach, or a housing and basic needs coach. And so they're getting support in multiple life domains, rather than saying, okay, well, you come to us for basic needs, and then you go down the road for somebody that does housing, or go across town for somebody who does employment. We have found a great scale of efficiency, but also in being able to help keep folks engaged in programming by having those services available under one roof.
I think they call it an integrated service delivery model.
That's kind of the formal name that we use, but
I had to look that up. It was like,
yeah.
What's that acronym? I find in the world of nonprofits, there's a huge list of acronyms that sometimes,
oh gosh, yeah.
I think sometimes can confuse people about where they can turn to, but you have so much under one roof, or as we say, 13 roofs.
Right.
How do clients typically get to you?
Well, most of our offices are located in communities where there is not bus service. And so a lot of people walk, a lot of people drive their car. Our Independence area locations are accessible. In fact, our main office on Nolan Road in Independence is strategically located just 50 feet away from the Independence Transit Center, which has buses coming in from KCATA, as well as the local Independence bus route, which is called Indibus. And in fact, my office, if you could look right out to my right here, I, for the last 10 years, have had a front row seat to the bus station. And it always helps remind me of the challenges that people face, because I see folks sometimes wheeling or carrying a big box of food, or, I hear about at the front desk, folks, I've got to meet with somebody super fast if I've got to catch the last bus, or whatever that might be. So folks access in a variety of ways, but one of the things we're dealing with now is how do we connect with folks with remote coaching and virtual sessions. And so some of that is helping to coach people through, helping them understand what Zoom is, or sometimes we do FaceTime. So using technology to connect with folks. But I will say, in a very broad statement, there's nothing like connecting with people on a very human level. And so to that extent, on Monday, June 1st, we are reopening our offices, of course, in guidelines or in accordance with the guidelines and protocols that have been set out. But you think about the struggles of families, and during this pandemic situation, there have been lots of public supports made available, mostly through the now famous CARES Act, whether that's additional food support, whether that's unemployment support. But those are difficult systems to navigate. And it's easy to say, well, here's a website, go figure it out. But if this is your first time doing it, or perhaps you don't have great literacy skills, or it's just confusing, it's helpful to be there with a person. And so we found that calling to be back and open and accessible to the public to help navigate those systems. So lots of ways that people engage with us.
Since before COVID, how many people were you serving in general in the course of a month, a year? And then let's talk post-COVID, or
sure,
during the pandemic that we still are in.
Yeah, great question. We, like every organization, track extensive data points. And for the last roughly 5 years or so, we have averaged serving a little bit more than 16,000 unique people a year. So that's kids and the adults in the household. So 16,000 people affected by our service. On average, the average person accesses or receives services between 4 and 6 times a year. So we tell folks that our doors open at all of our offices about 100,000 times a year. So pretty big and robust operation. What we've seen now post-COVID And we've seen this all the way from small towns like Buckner, where we have an office, to Independence, Blue Springs, Green Valley, even our office north of the river in Excelsior Springs. We are seeing right at a tripling or quadrupling of requests for service. And I think there's several reasons for that. One, overnight, literally overnight, tens of thousands of our neighbors were plunged into unemployment. And so they were caught off guard and like any family would do, immediately seeking, ways to stabilize situations. And I think, thankfully, I think we're outside of this, but there was I think all of us, regardless of income class, I think that all of us felt a little bit of a panic about the pandemic. We saw that at grocery stores where people were hoarding. Of course, lots of endless amounts of Facebook memes about toilet paper and things like that. But that was a very real thing where there was a run on the grocery stores and supplies of food and personal hygiene items. And, we saw a little bit of that too at food banks, not from an angry perspective, but people just very concerned about what was happening with the pandemic and wanting to connect with resources and making sure that there was plenty of food, personal hygiene items in the house. And so, those are some things that were really driving numbers. But we also saw a lot of families in the Kansas City area and beyond, really throughout the country. Many people rely on supports from a local community center or church or something like that. And, we saw with the shutdowns that happen, a lot of churches might have closed their doors temporarily, but that also in many cases stopped some of those ministries like food distribution. And so we saw families that we had never connected with before. And in fact, we saw families that were driving sometimes 90 minutes round trip just to access a food pantry because the pantry they were most familiar with was facing a temporary stoppage. And so those things, the instant unemployment, the uncertainty of the availability of supplies, as well as a number of food pantries or emergency providers that went offline for a period of time. Those three things really drove increased volume to our locations.
So now that we're kind of in this new reality, how are you as an organization dealing with that onslaught of people who are in need?
Well, the good news is two things. Our community is very generous and people are resilient. And I think that is a testimony to the human race that we are a resilient people and people find a way to make it through, to adapt. And we've seen that throughout this COVID-19 crisis. But you asked about how we are dealing with this new influx of folks, and that's really where the community support kicks in, and people have come from all over, whether it's foundations, corporations, churches, individuals, people coming up to they make cash gifts or gifts of food and personal hygiene items to help us do that. And those things help on a very grassroots level. But there's also been some very coordinated efforts, and government is always part of the solution, not the entire solution, but certainly part of it. And there are things like support through the CARES Act, which authorized more USDA, Department of Agriculture, commodities to flow to communities. Those are things sometimes we think about it, oh, that's happening in Washington, D.C., but there is a trickle there to our communities. So those things were put in motion and ensuring food supplies to families. And so we've been able to access supports like that. So it's a combination of grassroots community efforts, policy, things that are happening in Washington, D.C., and really stitching together those resources to make those available for our community.
Running a large nonprofit, what keeps you up at night, and how could we help?
Great questions. When I look at our organization, I can look at a lot of things. Of course, I think about the people that need our help. Some people need our help on a long-term basis. Some people need our help on a short-term basis. So I think about Do we have the resources to do that? And I also think about the organization from an employee perspective. We're grateful to have close to 60 people on the payroll that help run our operation, and they are professionals in their field, whether it's housing, employment, financial, social work, and even our staff that handles things like fundraising, development, accounting, et cetera, that they depend on CSL for their family's livelihood. And so one of the things that we were able to do was we accessed, I think what is now a household term, the PPP, the Paycheck Protection Program, Small Business Administration loan. And that was one of the first things that we did. We wanted to make sure we knew that we had to take care of our staff in order for our staff to be able to take care of our community. And so we were able to access one of those loans, and that gave us a real degree of certainty that we would be able to weather the storm. And very pleased to tell you that we've not had to deal with any staffing changes through all of this. And so with that out of the way, you can really focus. And our board of directors approved at its April board meeting a specific, I think, an 8-point plan related to a COVID-19 strategic plan. And it wasn't, incredibly complex. It just said, here's what we're going to do. We're going to make sure that our communities are saturated with basic needs, so that all people have an assurance that basic needs can be met, that there are resources out there for all people. But we also said that the backbone of the recovery is going to be employment. And so recommitted our employment strategies to making sure that now, as we are sort of coming out of the disaster relief response and moving into the recovery, that our employment programs are well positioned, well mobilized to help families, because we all know by now that there are many industries that have uncertain futures, and workers in those industries that have not gone back to work are probably thinking about, where do I pivot? Where does my career go? And so we are there and ready to help navigate people. One of my favorite programs that we offer under Employment Services is our Bridges to Career Opportunities program, and that tuition-free trains or retrains workers in healthcare and skilled trade pathways. And in fact, we have a brand new cohort of welders that started this past Tuesday in, like I said, tuition-free training. And so in just a couple weeks, they're going to be graduating with brand new skill sets and certifications, ready to go start a new job as welders. And so those are things that we are well positioned to be able to do to help our communities, not only through this emergency, but to take out of this emergency and be prepared for a new future.
Doug, thank you so much for what you all are doing. You're helping us weather the storm when life is, quote, normal, and as we go through new normal. If folks want to connect with you, again, website is the best?
Absolutely. But I would share with you, we have put up a special COVID-19 help center, and that is cslc19.org/help. cslc19.org/help. And we've compiled a lot of great resources and answers to questions that people have in our community. So we just appreciate you. We couldn't tell our story without great platforms like this. So thank you, and thank you to all the listeners.
It's recording me, but I don't think I'm getting your audio. Mm-hmm.